Hey guys, you're watching the Best Practice Show. We take a look at the best business practices from the best dental practices all over the world. And you already know this is coming. If you're paying attention to the world of CE, one of the hottest frontiers is here. And I've got my good friend, Dr. Wilkerson from the Dawson Academy to talk to you about what it is and how to get ready for it. So you don't want to miss this. Do me a favor, grab a pen and hit the share button. We'll see you in a few seconds. Hey guys, you're watching the Best Practice Show. Thank you so much for tuning in. We are having so much fun doing this, and I am so incredibly grateful. We are now up over 30,000 followers. I don't even know how that happened, and so I'm just loving your suggestions. Thanks for sending us, all of your suggestions. And again, we're into season 2 with some amazing programming, and today is no exception. I got my good friend Whit Wilkerson on, and you're going to love this. So just a couple show notes. We are shooting this live. So as you have comments, feel free to add questions to the feed, and I'll ask Whit himself, and we'll get the answers straight from the master right up top. So hey, Whit, I really appreciate you being on. You've been on before, and I know who you are. A lot of our friends know who you are, but if somebody's watching this for the first time and they don't know who you are, who is Dr. Whit Wilkerson and what is the Dawson Academy? Give us a little insight.
Oh, thanks, Kirk. It's good to see you. Well, I've been very fortunate and blessed to work in the practice of Dr. Peter Dawson since 1982. When I graduated from dental school, and I've seen the Dawson Academy evolve through the years from 3 seminars that he was teaching to many hands-on courses and other seminars that are part of the Dawson Academy, which I've been blessed to be involved with many of those. We've had, I guess, over 40,000 dental professionals come to St. Petersburg, Florida, where I live, and where the Dawson Academy is headquartered. For classes, but now they're all over the world. And so we've had classes held in India and China and Japan and Spain and England and Poland and other places like that. It's been neat to watch the world kind of come together in learning these things about dentistry and how interested people are all over the globe. And so it's just been a joy to be part of that and see our profession grow and grow and grow, and see so many young dentists particularly come into their own and commit to being the very, very best they can be and solving problems, which is really our focus, and solving problems that can be resolved through dentistry.
Yeah, it's amazing to watch you guys grow. You're everywhere. You're all over the world. And I always ask everybody this: can you ever remember a time that is this exciting in dentistry with all that's going on?
No, it's exploding. And I'm most excited that I believe with all of my heart that dentistry is going to be the leader in medical health care. And I don't say that because I'm a dentist, but because it's true that we have an opportunity because of our position, not only in where we work in the human body, which is right where everything comes in the oral cavity, and where so many things happen that are significant, but also because of the fact that medicine in general in the West is so caught up in the insurance bind, and poor physicians are seeing their patients on average about 7 minutes every 2 years, primarily just for one chief complaint. Whereas we're building relationships, we're seeing patients on a regular basis. We're spending an hour with them in many cases at a time alone. And it's just a remarkable opportunity as we learn more.
Yeah, and I know what you said is true about the future, and there's so many components of this. Now, you're also on the cusp of the learning side, and you're watching these trends happen in CE. So give us a little insight. What is the new frontier, the next frontier in dentistry?
You and I were talking about this previously, and I remember discussing that in the 70s, the subject was really occlusion and restorative dentistry. Things were shifting toward saving and restoring teeth rather than removing and replacing teeth. Then in the 80s, as I entered dentistry, I remember the development and explosion of the subject of temporomandibular joint problems and learning how to diagnose what was going on. Kirk, when I started, we didn't even know what a click was. We didn't know if someone's joint clicked or what was going on. And now we've moved all the way through MRIs and sophisticated imagery. Nothing can hide from us. We know exactly what's going on in those tissues. But then in the 90s, it shifted again as a new growing emphasis in what I would think of as cosmetic and aesthetic dentistry.
Right.
Remember the cosmetic revolution, and that's why our patients want California white and not A3.
Right.
What we started with on everybody over 50 years old, but nobody now. And that was a revolution that went through the 90s and on into the next century. So the question is, what does the 21st century hold for us? And what I see is there's definitely been a relaxing of the cosmetic revolution. A lot of patients are a little more conservative now, I think, than they were for a period of time, maybe more conservative even with their spending because of unsettledness economically, especially 2007-8, you remember, in that time when we had sort of a crash. And what I have seen in my patients and in the changes that are occurring is that the one thing that people are really interested in this country is their health.
Right.
They want to be healthy. They don't want, they learn and hear and read about accelerated aging and metabolic syndrome and these things, cardiovascular disease, and they don't want that. And they know there are answers for that, whereby they don't have to suffer from these chronic diseases that are our great malady. So we have a healthcare crisis, but it's a resolvable one. And as Dr. Michael Roizen from the Cleveland Clinic, who's the head of the Cleveland Clinic Wellness Institute, he's a prominent MD, the way that he words it is this. He says, we have a healthcare crisis that's going to bankrupt our country in a very short time unless one of two things happens. One would be we ration healthcare. And that is that you get less healthcare for your investment of insurance. Or the second option, and this is the winner, is that we get rational and we start taking personal responsibility for our own health and learning how to be healthy and to avoid heart attacks and strokes and avoid diabetes and avoid obesity and these different chronic things that just kill our health. And all the answers are available.
Right.
And so what I'm excited about is seeing dentistry engaged in those subjects as it appropriately relates to what we do.
Yeah, and you're seeing these trends now. I talk about this all the time, but these courses are filling up. You guys had a symposium a year ago, and it was crazy popular. This year, it was sold out. And what was the basis of the symposium? What was it all about?
Yeah, it was actually an Airway Symposium. And last year in January, we held one here in St. Petersburg and had 50 excited dentists there learning about things that we really never learned at school and the new sciences that are coming out. This year, we held our second annual Dawson Airway Symposium just last weekend on Friday and Saturday. We had to limit it to 130 participants, and we had a waiting list. And everyone was coming so excited to learn, but actually what we talked about was not what they thought they were coming for. So let me explain. I think dentists are very familiar with the idea that sleep apnea is a big deal and that it's something that is a big issue for overall health in our country. Over 30 million people, it's projected, have sleep apnea. And so dentistry has begun to engage in that subject. And there are a lot of courses now that you can go to all over the country on sleep apnea. The main gist of those courses up until now has been on seeing patients that have been identified or diagnosed with sleep apnea who will not wear a CPAP and the option of wearing an oral appliance that can open up the airway by moving the mandible forward. And so the gist of sleep apnea in dentistry has been making oral appliances as a substitute for CPAP, integrating that into your practice, learning how to work with physicians in your local community, and learning how you can get medical coverage in the form of insurance to pay for these appliances that we make.
Mm-hmm. Right.
Because airway and breathing is not a sleep problem.
Mm-hmm.
It's a 24-hour-a-day problem.
Right.
And so we're discovering now through the research that many young children are born with airway problems. And a easy example would be a young child is weaned and now is on dairy
Mm-hmm.
products such as milk, and they may be allergic to it. So they develop allergies. Now it's difficult to breathe through the nose, so they start breathing through their mouth.
Mm-hmm.
As you breathe through your mouth, your tongue stays low in your mouth, and it doesn't fill the palate as you swallow and suck and things like that that you would do naturally as a child or through eating. And add to that a very soft diet, which we often have today, a very refined diet. And you end up with changes in the dental arches that are very significant to us as we deal with malocclusion. So
Right.
the effects of mouth breathing because of nasal congestion or obstruction is that you develop very narrow maxillary arches, elongated or supererupted maxillary arches, crowding of the dental arches, sometimes anterior open bites, retrognathic situations. All those can be very frequently connected with airway and breathing disorders, you see.
Right.
So we all see these problems, but we don't think very often in the past about cause and effect. We just try to fix it,
Right.
but we may be looking at something even bigger. So
Right.
just like the example, Kirk, of you see someone come in with a lot of erosion on their teeth that is related to acidity. Well, they could have an eating disorder like a bulimia or something like that, but very often what you're seeing are the signs of gastric reflux.
Mm-hmm.
And that now has become a huge subject because esophageal cancer is the fastest growing cancer in the United States. It's increased by, I believe, something like 1,500% just in the last 15 years. And there's a strong association with acid being in the airway, meaning in the esophagus and the throat and the mouth and the nasal sinuses. They found acid out in the lungs that's coming from the stomach. But we can see that and see what a huge problem that is.
Mm-hmm.
That also can be very strongly related with breathing problems, in that one of the common reasons for acid reflux is sleep apnea or blocking of the airway, such that there's an effort to get oxygen down and air down the airway, but there's a blockage, and so there's a negative pressure from the down from the diaphragm that can bring acids up, and so that can go hand in hand. The subject is just beginning to explode. So as we look at the next frontier in dentistry and in medicine, I believe you're going to find that the subject of breathing and airway, the most fundamental of all functions, is critical for oral health, for dental health, for total health, for complete health. And dentists can be right on the front lines, screening and observing through so many things that we see in the mouth as key factors to identifying these not only life-threatening problems, but ones that have all kinds of chronic associations.
Right. And the tentacles of this problem go everywhere. They go into ADHD. They go into, you could almost link this to everything if you go slow, but we're going to be careful about that. Now, you even mentioned, go back to the asthma with young children.
Yeah.
These kids are being improperly diagnosed. They get tubes put in there. And really, some of this stuff, you say to yourself, the kid's not breathing.
Yeah.
So take us through, why is this so popular right now? Just connect the dots for us.
Let's talk a little bit about children. So a child that's having breathing problems, well, there's a couple of things that really are being looked at now from an anthropologic standpoint, meaning historical standpoint. What we're seeing is a change in actually the shape of the human skull
Hmm.
and of the dental arches.
Right.
And it's related to a couple of things. One is related to breathing. It's related actually even to breastfeeding and
Hmm.
to the development of the masticatory muscles through chewing. So if you have a baby and they're breastfeeding, they really have to work, in order to get their nourishment. And they're
Hmm.
using their tongue aggressively against the roof of their mouth. They're using their muscles of mastication, and they're developing all those. And it actually helps to grow your cranium,
Right.
helps to grow your maxilla. And with that growth will come a positioning of the eustachian tubes, whereby it's sort of downhill from the bone and you get drainage without using the masticatory muscles, such as not breastfeeding or eating very soft foods that don't require work and that sort of thing. The facial development, the development of the upper arches narrowed and restricted and less well developed. And you may actually have eustachian tubes that rather than pointing downhill for drainage of the fluids are more in the reverse direction and
Hmm.
you get more infection potential and therefore you get more tubes in the eustachian tubes and things like that. And so then the asthma you mentioned is another thing that can go hand in hand. So if I'm struggling to breathe as a young child, I'm struggling to breathe, and I begin breathing through the mouth and breathing shallow and rapidly, breathing from the chest rather than from the diaphragm. What can happen is the lungs don't fill with oxygen. They're not used in a complete way. And so
Hmm.
you may be only using, let's say, the top third of the lungs and the bottom two-thirds of the lungs are really relatively inactive because
Right.
the diaphragm is inactive. We're breathing from the shoulders and the chest rather than from down low in the abdomen. And with the lack of use of the complete airway or the lungs, then your risk for developing asthma go way up. Ben Moralia, who's an excellent clinician in Mount Kisco, New York, outside of New York City, participated with us in our Airway Symposium last week.
Hmm.
He works a lot with young children, teenagers, and he was telling us about how as they've been able to work with children and develop their dental arches and get them nasal breathing and work with oral myofunctional therapists to train them on proper use of their tongue and tongue posturing on swallowing and eating whole foods and just a whole gamut of things. They've seen kids whose ear infections have gone away, whose
Hmm.
asthma has disappeared, sometimes within weeks with chronic asthma and inhalers where they didn't need them anymore because they actually were using the whole airway. They were using the whole physiologic system of breathing properly. And it was completely turning around their chronic health issues that, were just being treated with medications and surgeries and things like that. So this is just the tip of the iceberg.
Right.
And it's a subject that is exploding, but we're seeing that it isn't new. There's a
Hmm.
lot of research that's been done that collaborates with what we're beginning to identify as true
Right.
and seeing clinically as positive outcomes. But you can go back and read research and say, well, it was there already. It was just we didn't recognize the connections, in many cases.
Right. Yeah. And when we put this in great context, dentists are just going to be required to think better. You guys have re-engineered even the diagnostic process in the
Yeah.
diagnostic wizard. You and I were talking before we got started. The orthodontist is going to play a much larger role than just occlusion and straightening teeth. Can you just dive into that?
Absolutely. And you'll see now there are orthodontists around the United States that are starting to identify themselves as airway orthodontists.
Yeah.
Airway orthodontists. And what we're finding is that as we're trying to create better breathing, healthy breathing, first thing we've got to understand is the upper airway, meaning the nasal airway, open? And so if it's not, we need to understand why, cause and effect. And so it could be allergies from the environment. It could be allergies from food. So we're going to be working more closely with ENTs in dentistry to help us both for pediatric and adult ENT to understand, is this driving this airway crisis that a patient may be having? So that'll be part of it. And that can also relate to enlarged tonsils and adenoids, which are lymphoid tissue that can swell and inflame because of being insulted with infectious sources.
Right. And deviated septums, so yeah.
That goes together. So that's one part of it. But we also recognize that when we do get someone breathing properly nasally and there's constrictions of the dental arch, that's still occupying a space that we're going to call the box in which the tongue fits.
Right.
So think of the tongue like a car going into a garage, and that garage is outlined by our dental arches. Well, you can't drive a bus into a garage that's sized for a Mini Cooper.
Right.
So if that's true, it's not because the tongue is too large. It's because the airway, the box for the tongue is too small. And so now the tongue's getting driven to the back of the throat where it can obstruct. So enlarging the garage for the car, which is our tongue, to be appropriate is a big deal, for normal breathing. And so that gets us into ortho. Now, if I'm a restorative dentist and I say, okay, I've got a patient with crowded teeth and cross-bite, narrow upper arch, and they've got abfraction lesions because they're banging around on their back teeth, and we don't have good anterior guidance of front teeth to separate the back and protect the teeth. And I've got periodontal inflammation because of crowding of the teeth that are boxed in because of airway. If we can get the patient breathing nasally, we can get the tongue operating properly, and we can enlarge the garage that is the house for the tongue.
Right.
Have a much healthier patient. So I believe in the future, the top restorative dentists are going to be looking at phasing treatment, and that in many, many, many cases of malocclusion, first phase is going to be expanding the dental arches to help encourage normal breathing. And now we're going to have a stable outcome when we do our restorative dentistry. So phase one in many cases is going to be perio/airway, right? And once we get that stabilized, now we can create stable occlusal outcomes and restorative and cosmetic outcomes that will be beautiful and healthy for a lifetime.
Right.
So it's a huge part of it. So I see restorative practices that will have an orthodontist working there, or they will become trained in an aspect of it, such as in clear aligners like Invisalign type work that could be done right in the hands of the restorative dentist. If more expansion than reasonable is required, then we'll either need orthodontics or orthognathic type solutions to go along with that. So I believe that you'll see that more and more and more. I mean, that's just going to be a given.
Yeah, absolutely. And I ask every airway expert, which I consider you one of the best, this, I think helping the younger restorative dentists understand, because this is overwhelming for some of them. They're like, okay, I know this is true, but wait, you're talking about a higher level of communication with the people around you. I don't know how to monetize that in my practice. I'm still in a PPO environment. I've got crowns to do all day. And you get some of the best in the world come for training. And I'm guessing you just calm them down and say, hey, look, let's start with some simple steps. So unpackage that for us.
Yeah, that's exactly right. And so we're developing protocols that we can help train. I have a checklist that I've developed that is for what I call integrative dental medicine. So, how does all this fit together?
Right.
Really, I see three primary areas of focus for dentistry.
Okay.
And one that's obvious would be infection and inflammation. So we know what inflammation looks like because we look at it all day. It's red, swollen, bleeds easily, right?
Right.
But this inflammation that we see in the mouth is often a reflection of a larger scale inflammation that's going on everywhere. In fact, almost for certain, that's
Right.
true. So we've developed questions to ask in your health history, things to look at clinically that are just 3 or 4 things, simple, testing and screening that you can do. So for inflammation and infection, we're doing more salivary testing for oral pathogens.
Okay.
Then there's a protocol or several for how you can resolve high levels of oral pathogens. And so a number of periodontal protocols. There's many that work. There's more than one way, obviously, to do this or skin a cat.
Mm-hmm.
And that's true in perio. But we're also looking at things like nutrition. I mean, what goes in comes out. And if what's going into a cell is inflammatory, what comes out is inflammatory.
Mm-hmm.
I hurt all over and I'm sore and I'm taking Advil and my back hurts and my joints hurt and I've got osteoarthritis. That's inflammation.
Right.
And I've got fibromyalgia and chronic fatigue syndrome. That's inflammation. And if we understand that, then so many of our patients are coming in, they're on fire.
Mm-hmm.
They're literally on fire. And so there are things that we can do from a dental perspective that are very significant. The second category besides inflammation and infection would be airway and breathing. And so there are some very simple questions we can ask patients about airway and breathing in our history questionnaire. There's some simple things we can look at. Let me give you a couple of examples.
Okay.
So an example would be the size of your neck. So studies have shown that if a woman has a 16-inch or greater circumference to their neck, their chances of having an airway challenge is in the 90 percentile. If a man's neck is 17 inches in circumference or greater, they've got a 90+% chance of having an airway challenge or, not necessarily sleep apnea, but struggling to breathe, which can be just as important.
Right.
So that's one thing. Okay, we open the mouth and we're looking at the dental arches. If we've got a narrow V-shaped palate and dental and maxillary arch, guaranteed they have an airway problem. Automatic, because it means they're a mouth breather, and we're designed naturally to breathe through our noses unless we can't.
Right.
If we can't, then we breathe through our mouths, and that changes the structure of everything. Have the patient just open their mouth real wide and look in the back of their throat and look for their uvula. If you can't see their uvula, there's probably a 90% chance that they have an airway problem.
Mm-hmm.
So that's easy to do.
Right.
So just examples like that. So we list that out and say, check this, check this, check this. It doesn't take hardly any time. Tongue. If your tongue is scalloped on the borders, outlining the upper teeth typically, it's because the upper arch is narrow and the tongue's broader than that, and it's resting on that, and you get scalloping. Mm-hmm. So scalloping is a high correlation with airway and breathing disorders. So that's easy. Another one is I have the patient open their mouth real wide and then lift your tongue up and try to touch behind your upper front teeth. So open real wide, touch your tongue behind your upper front teeth. Mm-hmm. Some people can only go about halfway up. Mm-hmm. The reason is because their tongue is tethered because of the tongue tie. Now, let's just think of the logic. If my tongue is immobile because it's tethered lingually underneath, then am I going to fill the vault and expand the upper arch and have plenty of room in the garage for my, no. Mm-hmm. And so that's going to create a constricted arch. And therefore, tongue tie can be a huge factor, not only for newborns trying to latch, but also for adults that are trying to function. Uh-huh. I saw a man who had a very constricted upper and lower arch, lots of crowding. And I'm looking at him, and new patient. I said, now open your mouth real wide and lift your tongue up as high as you can. He could only go maybe 40% of full range of tongue motion. And I said, do you know you have a tongue tie? And he said, oh, yeah. He's probably 60 years old. He said, yeah, my pediatrician told my mom and dad when I was little we never did anything about it. I said, has that ever given you any trouble? He said, I don't know. I said, well, do you have trouble like chewing food and digesting food and swallowing? He goes, oh, yeah, terrible. I can't really break my food down as well as I'd like and swallow. Well, you use your tongue against the roof of your mouth to mash and break down a lot of food boluses, but it's hard to do if your tongue is immobilized. And so I talked to him about tongue tie. And I said, if your tongue was free, it would make a big difference. He said, I'd like to do that. So we did a tongue tie release with a laser. Took less than 30 seconds, okay? He came back 2 weeks later. You know what he told me? He said, I'm a completely different person. He said, I don't know how to explain this, and I don't know if you'll think I'm crazy. He said, but I feel like from the top of my head to my hips, everything has released and gotten freed up.
Really?
He said, I was obviously breathing like this, and struggling and swallowing and struggling to swallow and choking and all these things. He said, and he had his tongue moving all over the place. And he said, now I've got so much freedom with my tongue. It's like everything has just relaxed now because I'm mobilized in my mouth. And I was astonished, but this is dentistry in 2018. And these are the things that we're learning that's just completely changing our perspective. As you know, Kirk, I've been working with TMJ disorders since I started in 1982. And Mark Piper, a very, very well-known maxillofacial surgeon, joined our group in 1983. He's an MD as well as a dentist and has probably done more jaw joint surgery than anybody in history. And we worked hand in hand with each other for many, many, many years. And I've made maybe thousands of splints for TMJ problems. And what we're learning is those chronic bruxers and clinchers and sore muscles and morning headache patients, even joint pain type patients, that the vast majority of them have airway problems and breathing problems. And in their sleep, they're struggling. They start to get into deeper sleep, but then their airway crisis occurs. They can't get enough, and they are aroused from deep to lighter sleep, and they're bouncing back and forth all night. It turns on your sympathetic nervous system, which is your stress hormones, because there's a crisis here.
Right.
And when you've got cortisol and stress hormones, epinephrine, norepinephrine flowing through your bloodstream constantly all night, you're going to have effects of that, which is increased stress in your whole system.
Right.
Not only can that cause tightening of muscles or bruxism and clenching, but sore muscles, headaches, overloaded joints, things like that. And we're seeing that left and right now.
That's crazy.
It is.
Yeah. So what can we anticipate as the future goes?
I think what we can anticipate is hopefully a much greater collaboration with our medical colleagues and a much, much higher appreciation for our role in helping to resolve many of these breathing and airway problems, because even though CPAP and even though oral sleep appliances may work, they're a treatment for a problem rather than a solution. Does that make sense? In other words, if my breathing is disturbed all day and then it's exacerbated at night, what we'd really like to do is try to reverse that airway problem and breathing problem day and night. And so we're learning about that, not only opening the upper airway up and evaluating whether there's allergies or deviated septums and enlarged adenoids and things like that, but also understanding that working with myofunctional therapy, where we get the mouth closed and start breathing through the nose and train the tongue to be properly positioned, expanding the dental arches to give room for that tongue to get out of the back of the throat into its normal up and forward posture, which is where it would normally rest physiologically if given the opportunity, that these solutions are coming right into the hands of dentistry and are teaming up with our medical colleagues to get great outcomes is something that I would expect to be a routine part of dentistry and medicine in the next several years.
Yeah, and it's just crazy exciting about what's going on and our ability to see more now. And with all the technology and, again, everybody's connecting the dots. This is truly one of the hottest things in dentistry as far as CE goes, the conversations. I think everyone in all of what they've seen, it's starting to make sense. And I couldn't be more excited. And you talked about the inflammation aspect of things. I mean, you can pull in tomorrow we have Dr. Amy Deneen from, Beat the Heart Attack Gene. And so she's like, I think everybody belongs at the table now having a conversation about the future of health in this great country that we live in.
Amy Doneen and Brad Bale are two of the greatest people I know, and their book, Beat the Heart Attack Gene, is a must-read.
Absolutely.
I have a huge appreciation for the role of oral bacteria in cardiovascular disease, and that's something you all can talk about tomorrow, but there's strong evidence, and I won't go into this, but there's strong evidence of oral pathogens getting into the bloodstream, getting into plaque, getting into blood clots that are from heart attacks, getting into the GI tract and causing problems. Association with some types of cancer in the GI tract are associated with oral bacteria. And so just exploding, but they're terrific. And their whole thing is inflammation.
Right.
They can keep it cooled down and deflame the fire that they actually will promise their patients that they'll never have a heart attack under their care.
That's a pretty big promise,
Big promise, and so far as I know, that's been fulfilled. But it's because they understand the mechanism of cardiovascular disease and strokes, and it's about inflammation. And nobody has a better handle on that than we do.
Right.
And it's something that we, know, but beginning to educate patients. See, the thing is, I think, Kirk, that can differentiate us, not only as a profession, but individually in our community, is the fact that when we have an appreciation for this and we start communicating it, our patients are blown away by the fact that, wait a second, you're my dentist, and now you're starting to help me get squared away other things that my physician hasn't been talking about.
Or has the time to.
It's because of time, yes, not necessarily because of knowledge, although the knowledge base is really rapidly growing. And, it's just incredible. I mean, we're in a new era of medicine and dental medicine. One of the things I really want to challenge everybody listening to this that may be in dentistry is the fact that we no longer are the stepchild to MDs.
Right.
And in fact, I don't want to say this in a negative way, but many today would say, if you want to go to a personal physician who will really look at you as a whole person, I would recommend going to an osteopath rather than an MD, because the osteopathic physicians are trained in whole health concepts such as nutrition and inflammation and these things, whereas the MDs had very little training at all on things like nutrition. What gasoline are you putting in your tank, Kirk? So I know you've got a Maserati, right? And so
not me.
Oh, you're getting one.
No, not at all.
And so are you going to put diesel fuel in that baby? Of course not. Of course not. I mean, you're not even going to put regular in that thing. You're going to put only the highest octane if you had a $200,000 car. But what do we put into our bodies and expect a different outcome? I expect to be healthy, but I'm eating junk food. It's ridiculous.
Right.
But the physicians have to understand that, and that's the counseling that we give our patients, along with exercise and obviously not smoking and good sleep, all those things, reducing stress, managing all the things that preoccupy your immune system from doing what it's there to do, and that is to keep you healthy and to fight disease, which it's very capable of doing. And so I see dentistry as having the opportunity to influence medicine. And when we do that by being the gatekeepers of inflammation, the gatekeepers of complete health, then we can begin communicating with the physicians where they're actually looking to us as advisors, as consultants, as part of the team. And when we can do that, everybody will get on board and we'll get proactive about being rational rather than rationing or just writing prescriptions. We can turn this thing around.
Yeah.
And we've got the formula now. It's there, and the answers are there. Yeah. And it's very, very doable.
Mm-hmm.
I think I told you last time we were together that Dr. Roizen at the Cleveland Clinic was telling us that 90% of patients with type 2 diabetes can reverse it without medication, can lower their blood sugar level to normal without medication through making simple lifestyle changes.
Mm-hmm.
Begin eating healthy, eat an anti-inflammatory diet,
Right.
begin exercising, begin managing stress, which exercise can do.
Mm-hmm.
Get good sleep. 7-8 hours is essential. You know,
Right.
you can't skip that as part of our overall health and rebuilding of our health and maintaining our youthfulness. So just logical, simple steps have been shown to reverse type 2 diabetes in 90% of the cases.
Right.
That's a fact. But the fact is also that almost 100% of patients with type 2 diabetes are just taking prescription drugs to manage their problem while it gets worse and worse because their lifestyle hasn't changed. See, so we can talk to patients about that and they receive it very well. And there's lots of books to share with them and you know, opportunity to learn this. So that's the kind of stuff I'm talking about. And airway is part of it, you know, inflammation, oral pathogens, it all goes together. It's all part of the formula for, would you like to be healthy? We can help you.
Absolutely. And also the question is, would you like to be a dentist in these times? And it is the greatest time. And there are people that fix teeth and there are people that change lives and now dentists. This is just, it's so cool to watch all of this great thinking, knowledge, technology come to the surface because we have a greater ability to help people be healthy more than ever. And I'm so grateful, buddy, that you're, you know, on here. So yeah. Now I know people are going to have questions. So as they have questions, how can we find out more information about this thinking and this frontier?
Okay. Well, we will be having a lot of courses in the Dawson Academy, of course, that will reach out in this area. But anybody that has a question, I'd be happy to talk with them or converse with them. So they can reach me through the Dawson Academy at D, as in dog, Wilkerson, Wilkerson, at thedawsonacademy.com. Mm-hmm. So they can reach me there, and we'd be happy to address questions or share with them opportunities, not only through the Dawson Academy, but many opportunities. I'm part of an organization that I highly recommend called the American Academy for Oral Systemic Health, AAOSH, or we call it AOSH. Mm-hmm. And I was privileged to be president of that organization this past year. And we are actually collaborating with other organizations to create a revolution, because that's what we need. Mm-hmm. And I think people that are engaged in our profession want to see that they're part of something bigger that's growing, that's a movement that, you know, they can jump on board. So AOSH will be having a national meeting in November in Las Vegas, and I believe it's the 8th through the 10th, but I don't have my calendar in front of me. And we're going to combine with the American Academy for Physiologic Medicine and Dentistry, AAPMD, which is primarily an airway group of dentists, physicians, and other practitioners, and with ACAM, which is the American Academy for Integrative Medicine. So those are all physicians. And so we're going to have the physicians, the dentists, the other people interested in these things all come together for one big meeting in November in Las Vegas. So they can look up under the AOSH website, but we're hoping to have 1,500 people there that are all clinicians like ourselves that will be able to learn these things and integrate and collaborate and really just jumpstart this into something bigger and bigger. The American Equilibration Society, some may go to the Chicago Midwinter. That's just in a few weeks. The American Equilibration Society this year is focusing our meeting on this subject of complete health and dentistry. We're not only going to have people like Robert Lustig, who is the champion for the fact that it's primarily sugar, not fat, that's killing us. And he's at the University of San Francisco. He's going to be presenting. I'm going to be speaking. Our friend Susan Maples and others are going to be speaking there. And then we're going to have 3 deans, Henry Grimion from the LSU and 2 others, are going to be doing a panel together on the future of dentistry and talking about complete health as the future of dentistry. And so 3 prominent deans of dental schools are going to be there to share their belief that this is the direction that we're headed and that that's what they're pushing for, along with the other deans that they're seeking to influence as the curriculum in the dental schools will begin to move in this direction. And it's just so exciting. I mean, it's as these truths come out and you realize we're on to something huge here that we didn't anticipate when we started making oral appliances for sleep apnea.
Right.
And now we realize it's just opened a whole new world of possibilities that is very, very exciting. I mentioned there were 3 legs or components to this integrative dental medicine model. I said inflammation and infection is one, airway and breathing is one, and the third is TMD and occlusion. So we're going back to home again and saying, you know, no one else in medicine knows anything about TMD except through dentistry, and occlusion, of course, and the role of occlusion in overall health and how it can mirror problems as we've described. But that's a big facet of our role that cannot be fulfilled or filled by anyone else. So we want to maximize that and also see how all these things integrate, which we've been discussing, and how they overlap back and forth, and they all relate to each other. So it's just mind-blowing. I mean, I'm having a hard time getting my 7 or 8 hours a night just because I wake up in the middle of the night with all of this, you know, explosion of ideas, and it's just so exciting. I feel like I'm just starting over.
That's awesome. Well, it's always exciting talking to you, my friend. I learned so much, and I'm grateful for our friendship. I'm going to be down at the Dawson Academy next week. If you're a young dentist and you haven't seen what it's all about, you got to check it out, and you got to check out Whit's programs and reach out to him. He is one of the most giving people I know in dentistry. So, buddy, thank you.
Well, I don't want to say goodbye without thanking you, because your influence in my life has been tremendous in just understanding how do you manage all of this? You know, how do you orchestrate all of this? How do you put it together in a way in which it's both meaningful but also a profitable business model and successful interaction with people as you engage in them. And Kirk, I just thank you so much for your influence in my life.
Well, it's a feeling's mutual, and it's my pleasure. That's what we're all here for, right? To help each other.
That's right.
Yeah. So stick around while we say goodbye to everybody else. But thank you guys for watching today. We just really appreciate you tuning in. If you enjoyed today, which I know you did, just do a huge favor and hit the share button, share it with your friends, and keep sending us suggestions for shows that you want to see. Even with Whit, we're going to have you back so many times because there's an infinite amount of information and learning in this subject and the future of dentistry. So thank you so much for watching. So until we see you next time, keep watching the Best Practice Show. You guys have a great rest of your day.